Samantha LaRocca. I'm doing case number 5. A 64-year-old patient is referred to PT with diagnosis of lumbar spinal stenosis. She reports worsening low back pain bilaterally over the last 2 years. She denies any trauma or incident, but states that as a police officer, she spent lots of time sitting in her car. The pain is located bilaterally in the low back and buttocks region. The patient denies bowel and bladder dysfunction, denies lower extremity paresis or weakness. Recent radiology reports reveal widespread facet arthritis and disc degeneration. Past medical history includes hypertension, abdominal polyp surgery, and physical exam reveals decreased joint mobility in the entire lumbar spine, paraspinal tone and tenderness, normal lordosis, negative neural and myotome screen. Lumbar active range of motion is within normal limits. However, hip motion does dominate. Hi, I'm Sam. I'm the student physical therapist that's going to be working with you today. Before we get started, could I just confirm your name and date of birth?
Yeah, it's Zach Hopla, 6'7", 96.
Great, Zach. So what I want to do today is I just want to check out how your lower back is moving. Is that okay with you?
Yeah, that's fine.
Great, so if you could just turn on your side for me.
Yep.
So this first exam I'm going to do is lumbar joint mobility testing. An alternative exam I could do could be a neural tension test, but today to start I'm going to do the mobility testing. So Zach, what I want you to do is just go ahead and relax your leg. You don't have to actively move it.
Okay.
Okay. So I did see some hypomobility in his lower back, but because the patient also has tone and tenderness in his paraspinals, I want to do a manual treatment technique and do lumbar STM. So Zach, what I want to do next is just kind of massage out those low back muscles, kind of relieve some of that tone and tenderness that you have. Is that okay?
Yep.
Great, so I'm just going to switch out the pillows for you.
Okay.
Go ahead and lay under this for me if you can.
Yep.
And you can lay on your side, facing me again.
Oh.
Yeah, I got it.
Thank you.
This would be good to do for about 5 to 6 minutes. And if the patient did not tolerate this technique, 2 options. I could either mobilize his lumbar region. Because the patient has a spinal stenosis diagnosis, I could mobilize above and below the lumbar region. A second alternative technique I could do is start working on the patient's PGM activation. Now I'm going to move on to home exercise programs for this patient. What I want to start with on this first visit is thoracic rotation. This is going to really help the patient today in the clinic and also when they can do this at home, just to even start self-mobilizing his thoracolumbar region. And it's an easy home exercise program the patient can do once I show them correctly how to do it. So Zach, what I want you to do is just perfectly stay in this position. I'm just going to bend your legs.
Okay.
I'm going to take this pillow out from under you.
Okay.
Okay, you want to lay on this one?
Sure.
You can scoot down a little bit. Okay, so Zach, you want to make sure your hips and knees are both in basically like a 90-90 position.
Okay.
And you can put your arms out to the side here. What I want you to do is just slowly rotate and follow your nose with your hand.
Okay.
Just nice and slow. When you feel like you can't go anymore, I want you to hold for 10 seconds. And what we don't want is this portion of your low back to move backwards.
Okay.
So go ahead and come back. Just nice and slow. You can do this 10 times on each side. You can do this at home whenever you want, whenever you're feeling stiff. And then on visit 3 for this patient, this thoracic rotation exercise I think is a really good pre-neutral spine exercise in preparation to do TA activation. So on visit 3, I would want to introduce either heel slides or bent knee fallout to this patient with TA activation. And then on visit 6, I would want to progress that to either marching or double marching based on the patient's progression. And like I said, if the patient did not tolerate that soft tissue massage I did, I could either mobilize the patient's back above or below the hypomobile segment or do the posterior glute med activation. Zach, do you have any questions for me?
I do not.
Great.